All right. Hi, I'm Dr. Ben Newman. I study coronaviruses for a living and read a lot of papers. I'm going to try to use them to answer your questions. All right. Our first question here is from Tanya. Good morning. And hello again. Yeah. Let's see. So the question is, seeing how successful early interventions seem to be in Mr. Trump's recovery. Okay, wait a minute. Yeah. I think so. It may well be that the president is recovering well. It may also be that the president is doing his usual trick of kind of trying to will something into being, trying to live his life as though there's a certain reality and then just make that appear, which I would call wishful thinking. And so I think there's a lot of politics here. I don't think any competent doctor would have ever told him to go out in a motorcade and wave to people while you're under treatment for an infectious disease. And maybe that's why he's got 10 doctors like that. You know how in those toothpaste commercials or whatever they say 9 out of 10 doctors agree that brushing your teeth is good. I think maybe the idea is that there's that 1 out of 10 doctors there that's just like, just do whatever, man. Do whatever. It's okay. Yeah, so maybe that's why you get 10 doctors. Anyway, yeah, the actual intervention, the two things, the Regeneron antibody treatment, which is an IV drip that they would put in, that seems to be probably only effective really early on. So they have not released much of anything about that, actually. But Regeneron do make other antibody treatments that are given in a similar way, and they have actually looked with some of those to see how long they live in the body, how long they can persist. The amount of antibodies seems to drop, have a half-life, get cut in half, in about a day or maybe 2 days at the outside. And there are still traces of the antibody there after 3 months, but you are definitely going to get your most effect immediately, and any residual effect may help, but you probably want an additional dose, I would say. Let's see. As for the other treatments that he has received, he may have had a steroid. I thought I had heard dexamethasone thrown in there, which is fine. It does have some pretty bad side effects, and so far there aren't many strong indications that this would actually do anything for people with, well, severe or mild COVID-19. It's one that has not been particularly successful so far. It's a thing that seems like it should work, but it hasn't really panned out yet. Remdesivir is kind of the same way. It definitely beats up the virus if you put it into a petri dish with some cells. Yeah, virus and drug. Yeah, it just lays waste to the virus. In actual people, the results are in the clinical trials that have been published, the difference was something like 5 out of 200 people to 10 out of 200 people will get out of the hospital a day or two faster with remdesivir than without. So it's a thing that definitely hits the virus and really should work, but we're dealing with, I think, a more complicated situation. And it is just, I don't know that you can just hold down the virus and expect to calm down all of the immune system side effects, which are where most of the disease is coming from. So these are treatments that he's been given that seem to have their greatest effect in people with mild COVID-19, and that effect seems to be in getting them out of the hospital a little bit sooner. Honestly, if we were going by sort of one of the more stringent protocols, a person who has had a lab-confirmed case should probably not be let out of the hospital until they should have at least 2 tests a week apart, and those tests should both be negative. They should be testing not just like saliva tests, but probably fecal samples or the up-the-nose stick samples. And even then, there should be like a minimum of a 14-day stay in hospital. I understand that he's a busy guy and he's got a lot of stuff to do, and he's not the only one. There's probably a lot of other people that say, well, I'm a busy person as well, and I've got a lot of stuff to do. I need to get out there, drive around in my motorcade and sign papers and stuff like that. And I suppose I like the bravery of that, the sort of we're going to fight through this. I do not like it at all from the standpoint that if you have the virus inside you, the virus can come out, and by moving around, you are definitely putting other people at risk and leading to more infections, more misery, more problems. You're just giving your problems to other people, which maybe that's what politicians do. I don't know, but I don't think that's what anybody should do. Let's just say that. Yeah. So no, that doesn't seem like the most responsible course of action from a scientific or epidemiological point of view. And really, those are the only points of view that have anything to do with the virus. All the other points of view that you get, economic and political, just have to do with people and opinions and hopes and wishes. And I don't know, those don't seem like a great way to run anything. Yeah, to me. So, yeah, the science is real equivocal on whether those drugs actually do anything. They don't seem to be harmful, but there is not a whole lot of benefit in any of the things that he's taken that has actually been clinically demonstrated so far. And I think with all of the weird, hyped-up politics on steroids that's kind of going on top of this thing, I don't know that you can take at face value that the president has necessarily made a dramatic and quick recovery. I think you just gotta wait, and time will tell. And yeah, hopefully the people around him are saying, it's fine, you've made your appearance, and now let's put a mask on, let's keep you away from other people, let's deal with this thing, and then after that's done, then boom, back to all the other stuff. Yeah. So there you go. Yeah. If the president's listening, hi. Hope you're doing well. Yeah. I'm sure he's not. Thank you very much, Tanya. Very good question. Yeah, and yeah, I hope you stay well. I hope everybody around you stays well. This has been Ask Dr. Ben.